Hello, I'm Dr. Lisa Potts, a bone health specialist with Orthopaedic Associates of Muskegon. In this video, we'll talk about the importance of bone health, steps you can take to keep your bones strong and healthy, and ways to reduce your risk of fracture. Osteoporosis and osteopenia are chronic, progressive diseases where weakening of the bones may make them more likely to break. Breaking a bone is a serious complication of bone loss that leads to permanent pain, limited mobility, height loss, and even long-term nursing care. A significant number of seniors who break a hip die within the first year. You may not see any signs or have symptoms of poor bone health before you fracture. Fortunately, there are many proactive steps that you can take to prevent bone fractures. First, have an evaluation of your bone health with a bone mineral density test or DEXA scan. These tests can tell if you have weak bones or osteoporosis and predict your chance of breaking a bone. They can also tell if your bone density is improving, getting worse, or staying the same. Women over 65 and men 70 and older, younger people with risk factors, and people over the age of 50 who have had a broken bone should have a bone density test. Ask your doctor if it makes sense for you to get tested. Make sure you're getting enough calcium and vitamin D. When we don't get enough calcium, our body takes it from our bones. This is fine once in a while, but when it happens too often, our bones get weaker and can break more easily. Dairy and calcium-fortified foods and juices are the best source of calcium. And if you take a calcium supplement, it's best to take it with food. Your body needs vitamin D to absorb calcium, and studies show that people with low vitamin D tend to have lower bone density. A simple blood test will tell if your vitamin D level is sufficient. If it's too low, a daily supplement can raise your vitamin D to a healthy level. When you're at high risk for fracture or have had a non-traumatic fracture, medications are needed to significantly lower your risk of fracture. Medications can stop bone loss and even stimulate new bone growth to lower your risk of fracture. Ask your doctor if a prescription medication could improve your bone health. Exercise is important for maintaining bone health. Weight-bearing exercises such as walking, running, elliptical, and dancing should be part of your normal routine. Your goal should be 30 minutes, 5 to 7 days a week. Muscle strengthening is also important to maintain strong bones and muscles. Examples include weightlifting, using exercise bands, or body weight muscle strengthening. Try to exercise each major muscle group 2 to 3 times per week. Muscle strengthening, along with balance exercises, can help prevent falls. Excessive alcohol intake and smoking also weaken your bones. Avoid excessive alcohol use, and if you don't smoke, don't start. If you do smoke, talk to your doctor about the most effective ways to quit. Avoiding falls is an obvious way to prevent fractures, so educate yourself about fall prevention. Slow down and stay alert when walking in public. Wear appropriate shoes and be sure to wear your glasses and hearing aids if you need them. Be aware if your medications are more likely to cause dizziness. Strong, healthy bones are an important part of living your best life, especially as you get older. The team at Orthopaedic Associates of Muskegon is here to provide resources and treatment to ensure your bone health is at the highest level possible. Call us at 231-733-1326 to schedule an appointment with one of our bone health specialists.